Hi guys, this is Shahul. Today I'm here with a new video. This video talks about management of a person at a critical situation. In this modern era, we come across many persons who get critically ill at many situations. We may see critically ill patient at a road traffic accident, or we may see a critical ill patient during heart attacks, or we may see critically ill patient during stroke. So what we need to do and how do we manage those critically ill patients? And if we know these basic concepts, then it is enough to save the life of people, to save the life of a person. And my topic is airway, breathing and circulation. When do we call a person to be critically ill? We call a person as critically ill when his airway is not proper, or when he is not breathing, or when his circulation is not in a stable manner. Even when this airway and breathing and circulation is proper, then that means that life is still persisting inside that person. Whatever severity the other injuries may be, the person can be saved. But when there is a compromise in this airway, breathing and circulation, it becomes difficult for the person, and it becomes a mandatory to intervene the person as early as possible, so that the prognosis becomes good. We know that brain is an organ which completely depends on oxygen, and it can't withstand it cannot withstand the cut supply of oxygen not more than a minute. After a minute, when there is no oxygen to the brain, damages start occurring. At the 10th minute, there will be complete damage to the brain, and at last, death of the patient. So we need to maintain a proper oxygen supply to every tissues of our body with a proper perfusion pressure. So to make this is the ultimate goal. So to make this, we have made three sets of criteria. One is proper airway, next is proper breathing, and then is proper circulation. So let me tell you in a stepwise manner what you need to do in a critical situation. First, you can see a critically ill patient, as I told you before, in a road traffic accident, or in a road, or even in any of the houses. So the first, our safety is very important. Check for any danger signs not in the patient, in the surrounding area. So if the surrounding area is safe, and if the surrounding you don't get any danger, first thing what you need to do is call for 911, call for emergency, then go and intervene. Done. So you go near the patient, you first check whether the patient is conscious or not. If the person is conscious, though he is bleeding or severely or something like that, if the person is conscious, then there are increased chances that the person can live. If there is no, that means that if the person is conscious, that means that his circulation is proper, because we know that if the brain is deprived of oxygen even for a minute, the first thing we lose is consciousness. So the person is conscious, that means that the person's circulation is good, but still he may have any obstruction in his airway, or he may have any breathing difficulty, or even he may go for respiratory failure. So the first thing what you need to intervene is check for his consciousness. If the person is conscious, it is well and good. But the problem comes here. If the patient is not conscious, what you need to do is, first thing is to maintain his airway. How do we maintain the airway? So that is what we need to know. If the person is unconscious, what happens is there are increased chances that the tongue may fall backwards, and it may obstruct the laryngeal inlet. So the first thing what you need to do is make the person to lie supine, lift the chin of the person, and extend the neck of the person. By doing so, what you are doing is you are making the tongue to come forward, so that it will not obstruct the airway. Because we know that the attachment of tongue is at the submental region, so if we pull it forward, if we extend it, automatically the tongue comes forward and we clear the laryngeal inlet. Because the most common obstructing agent of airway in an unconscious patient is tongue, his own tongue. So you have done this, and you have made sure that the person's airway is patterned. And the next thing what you need to do is check for his breathing. You can check the breathing of the patient by inspecting chest rise of that patient, or you can feel the air that comes through the nostrils. If the person is breathing, it is well and good. You just keep the airway pattern, and if the person is breathing, make him to lie in a recommended position. Don't continue the supine position, because there are increased chances that the person may vomit, and that vomit may go for aspiration. So make the person to lie in a recommended position. By doing so, you also make the tongue to come forward, so that it will not obstruct the airway. Then the problem arises when the person is not breathing. When the person is not breathing, the first thing what you need to do is check for the circulation. If the circulation is there, if the heart is pumping, but still the person is not breathing, we have a set of intervention that we need to do. If the heart is also not working, if the heart is also not pumping and there is no breathing, we have another set of manifestation. So first, let's come and look at this. If the heart is breathing, that means the circulation is good, but the person is not breathing. The first thing what you need to do is a procedure called as rescue breathing. That is mouth-to-mouth resuscitation. How do you do that? We have a set of procedures to do mouth-to-mouth resuscitation. Number one, seal your mouth completely with the mouth of that critically ill patient. There should not be any gap left. Number two, seal the nostril of the patient so that when you breathe into his lungs, the air doesn't escape through the nostril. Number three, give a slow and deep breaths. Number four, give 2 breaths. Number 5, you can have any cloth or some mask in between mouth of yours and the patient, so that infection of yours or infection of his doesn't get transmitted to each other. But at critical situation, when you don't get that, don't go and search for it. You can have a direct mouth contact and give 2 slow and deep breaths. While you are giving, look for the chest rise of the patient, because when the patient has any obstruction, even when you breathe, the air will not enter the lungs. So you need to, when the air is reaching the alveoli, when your breath is reaching the alveoli of that patient, definitely the person will have a chest rise. So while you are breathing, simultaneously look for chest rise. After two slow breaths, look for breathing, because at times, because of shock, the persons may have a temporary stoppage of breathing, and when you have this trigger, when you give this trigger by external stimuli, the person will start breathing. If the person is not breathing but still his circulation is well and good, then what you need to do is continue this breathing at the rate of 1 slow and deep breath for every 5 seconds till the emergency department comes. Continue this procedure. This procedure is called as rescue breathing. Okay, you are doing this, but in a second set of scenario, what we discussed previous is when the person is not breathing, at the same time the person's circulation is not good, the heart is not pumping. How do you check whether the heart is pumping or not? Palpate for carotid pulse. What you need to know when you palpate for carotid pulse is, number 1, palpate on only one side, don't palpate on 2 sides simultaneously. Number 2, palpate not more than 10 seconds. So if you are not sure whether his circulation is not good, whether his circulation is good or not, don't wait for it, just go for CPR. That is cardiopulmonary resuscitation. The first thing what we discussed is rescue breathing, where his circulation was good, but we just supported by breathing. We just supported with external stimuli. But here you have to maintain the heart of the patient, and at the same time you have to maintain the lung of the patient. First thing what you need to do is go for cardiopulmonary resuscitation when his circulation is not good. We have a set of procedures how you need to do a CPR management. Look for this video first and observe what this person is doing during a CPR management. So you have watched this video. So let me explain what are all the procedures you need to follow. Number 1, keep your dominant hand beneath. For example, I'm a left-hander, so my dominant hand is like this, and my non-dominant hand will have to fist around. We'll have to encircle this dominant hand. Number 1, this is a proper position. Number 2, before doing this, what you need to do is exactly locate the place where the heart is. So the exact location is just 2 fingers above the Xiphi sternum. He might have done that in that video. You would have seen. First, keep 2 fingers just above the Xiphi sternum. So at that point, you keep your hand like this. Number 2, your elbows should be locked. This is a very, very important point. You should not give compression by the help of your triceps. You should give compressions with the help of your weight of the body. So you have to completely extend your arms. Your elbows should be locked. So it should be in this position. Number 3, at what rate you need to give CPR, at what depth, how deep you have to have that CPR, you need to do this. Coming to the rate, you have to start your CPR at the rate of 15 CPRs in 10 seconds or 100 CPRs in a minute. So you need to do CPR nearly 1.2 or 1.5 CPRs in a second. That means you have to, because you need to know the rate, you have to have the rate. Or else, to have a simple calculation, do 3 CPRs in 2 seconds. Okay, that means that you have to do more than 1 CPR, nearly 1.5 CPR in a second. So that means that you have to do it fastly. That is what I wanted to stress about. You need to do it at a faster rate. Number 2, how deep it has to be. You need to make the ribs to go 4 centimeters deeper, or probably 1.5 to 3 inches to 1.5 to 2 inches deeper. That is very important. You should not just do it. No, the heart won't get compressed. You need to go 4 centimeters deeper, even if the ribs get fractured. Don't hesitate to continue the CPR. because life of the patient is very important, we can treat the fractures of a rib, but we can't treat a person who has gone for irreversible heart damage and brain damage. So go for CPR even if there is fractures of the rib. And next thing you have to do is you have to maintain the lungs simultaneously. Make sure, look for other person. When you are the only person who is going to intervene, then you have to do it one after the other in a sequential manner. Have 15 compressions, then go for two slow and deep breaths. Then once again come back, have 15 compressions in 10 seconds, then go for 2 slow and deep breaths. So you need to do this simultaneously. Or when you have when you have two persons to intervene, one person take care of CPR, give 15 compressions in 10 seconds, and the next person will take care of that breathing. After completion of this 15 compressions, the next person will go for 2 slow deep breaths. And you need to do this in 4 sets. 15 compressions, 2 breaths. Next 15 compressions, 2 breaths. Next CPR set. Next CPR set. After 4 CPR set, you go for examination. Check for the cardiac pulse and breathing. There are more chances that the person can breathe it. But still, if the person doesn't breathe and if the circulation is not proper, you need to continue the CPR in 15x2 manner till the emergency department arrives to that place or till the patient is being brought to the hospital. So in this video, I believe that you have learned something about what is rescue breathing and what is CPR and how to manage these cases and what are these procedures. Thanks for watching. Thanks for your patient watching. Till the next video comes, this is Shahul signing off. Bye.